In this video, laboratory diagnosis, the special test of megaloblastic anemia, Schilling test. What is Schilling test? This one used to determine normal or abnormal vitamin B12 absorption. This test mainly used for determine whether the body absorbed normal or abnormal vitamin B12 to assess causes of vitamin B12 deficiency. So, megaloblastic anemia caused by vitamin B12 and folic acid deficiency. This test specific test for vitamin B12 deficiency identification, folic acid or folate identification, we are using Figulu test. So normal range of vitamin B12 282,000 picogram per ml. So let's discuss Schilling test. Then when it order usually done vitamin B12 deficiency or pernicious anemia. This test mainly used for identification of vitamin B12 deficiency or pernicious anemia. Find out that presence and causes of vitamin B12 malabsorption. Here we can take 24 hours urine sample of that patient. Okay, we will take this patient having all megaloblastic anemia symptoms, okay, fatigue, tiredness, along with the tingling sensation. Okay, so we collected blood sample, we will do CPC less hemoglobin, we will confirm anemia. And ask patient vitamin B12 level, that one also less. So what is causes of vitamin B12 deficiency? So three things will causes vitamin B12 deficiency, whether less intake, okay, decrease intake, otherwise impaired absorption, we will take normal but our body cannot absorb normal, otherwise increasing requirement during pregnancy lactation periods, increasing requirement. So these are the three causes, three important causes of vitamin B12: decrease intake, impaired absorption, and increase requirement. So here solution, what we will do, give oral vitamin B12 in the form of tablet. Okay, this one is the hot, this one is the radio labeled one. Here radio isotope we are using 58 cobalamin or 57 cobalamin. It is the radioactive isotope we are using. Otherwise intramuscular injection, cold or non radioactive. So we will give treatment first, vitamin B12 in the tablet form. This one is the hot radioactive one. Then intramuscular injection, cold one, non radioactive. After injection it will go into that blood, this okay, this tablet form also, this one, it will saturated the store. So first you will give injection, okay, then you will give tablet. First saturated the store, first will give injection, then only give tablet. So oral tablet will reach to that esophagus, then stomach, then after that it will reach to intestine. So here increase intake, decreased intake, vitamin B12 food we didn't take means it will cause us deficiency, otherwise we will take enough amount of vitamin B12 food. But here that pancreas, this parental cell is presented in that stomach, here it absent means it cannot secrete that intrinsic factor, so it will causes pancreas anemia. Suppose we will give artificial intrinsic factor means it will bind with the vitamin B12, it will reach to here intestine. So here also two different type of problem. One is bacteria overload means it cannot absorb. So here prevent this problem, this bacteria overload prevent that absorption. So here we will give antibiotic, it will kill bacterium. After that observation process will happen. Second, pancreatic abnormal, here alkaline secretion is there, means it also cannot absorb. So whether vitamin B12 intake not taken, otherwise we will take, but here that pernicious anemia will happen, means it will causes vitamin B12 deficiency. So artificial method we will take intrinsic factor, it will bind with vitamin B12. Here we have problem, means it cannot absorb. So here we will treat by using artificial intrinsic factor. Here we will treat, give antibiotic, it will give kill bacterium automatically, that vitamin B12 absorption will happen. So give oral radio labeled vitamin B12 along with the intramuscular unlabeled B12 shot. Then 24-hour urine should be collected and the estimated labeled B12. If it will be more than 10 percentage of that radio labeled, oral radio labeled, more than 10 percentage absorption, means there is no malabsorption. Suppose it may be less than 10 percentage, means malabsorption confirmed. After that we'll give intrinsic factor. These tests will repeated. Then 10 percentage more than 10 percentage means pernicious anemia corrected. If less than 10 percentage means 10 percentage treated with 3 week of antibiotic. After repeat the test. Then next, more than 10 percentage blind loop syndrome corrected. More than 10 percentage means blind loop syndrome corrected. Suppose less than 10 percentage means estimate vitamin B12 less than 10 percentage, means give pancreatic enzyme and repeat the test. This one more than 10 percentage in pancreatic means insufficient corrected. Pancreatic insufficient corrected. Less than 10 percentage means malabsorption symptom like corn disease, celiac, sprue, like that. So this is the protocol for Schilling test. More than 10 percentage means pernicious anemia corrected. Less than 10 percentage means give antibiotic. So after that we can repeat at the test. More than 10 percentage means that blind loom syndrome corrected. Less than 10 percentage means we will give pancreatic enzyme. Repeat the test. More than 10 percentage means pancreatic insufficient corrected. Less than means we have affected from intestinal disorder like corn disease and celiac sprue. So in this video we discussed Schilling test used for vitamin B12 deficiency and pernicious anemia. How to collect sample, how to treat, all the things we discussed. This one is the protocol form. Thanks for watching.